you for coming. Our county has been leading the fight in partnership with our local cities to clean up the Tijuana River sewage crisis. And I really want to thank Imperial Beach Mayor Paloma Aguirre for all her leadership and for joining me here today. The policy I'm outlining this morning empowers our county health experts to work with the community to make more health data available, develop stronger decontamination protocols for sewage-contaminated floodwaters, and to expand the way we respond to health threats involving the sewage crisis. We are all too familiar with beach closures due to sewage. Some beaches have been closed for more than 900 consecutive days. These closures are the visible impact of how this Tijuana sewage crisis impacts all of us. But there is a hidden risk that needs to be taken into account. There is a growing body of research indicating that airborne contamination could potentially also make people sick even beyond the beach. Studies by the Scripps Institute of Oceanography shows that sewage-associated bacteria can be aerosolized by the ocean waves, potentially exposing unsuspecting communities. Up to 3/4 of the bacteria found in IB come from this aerosolization of raw sewage in the surf zone. And flooding from the sewage-contaminated Tijuana rivers overflows into streets, parks, and other public spaces where residents could potentially come into contact and become sick. Mayor Aguirre has formed a task force of scientists, doctors, and experts from San Diego State University and the UC San Diego who've been studying the situation, and the county has been at the table in these conversations. But this policy formalizes our support for this incredibly important initiative. The recommendations in the policy I'm bringing forward tomorrow were developed with input from the task force. In the policy I'm proposing, we're looking at some very specific action steps, including launching a first-of-its-kind community health survey, which will look at the health impacts beyond direct water exposure. We're going to be developing a Tijuana River public health dashboard. We're going to be developing a local decontamination protocol for sewage-contaminated floodwaters, which might have been helpful in the recent Hollister spill, had it existed at the time. And we're going to be collaborating with the task force to develop a list of data sources that can support tracking sewage-associated non-reportable diseases. We're going to be requesting zip code level data from the California Breathing Program. We're going to be increasing communication with other agencies so that we can better survey and test the area under their purview, including the San Diego Regional Water Control Board, the Air Pollution Control District, CPDH, and CDC. We're also going to be pursuing additional funding and support to assess economic and public health impacts of the sewage crisis. We've been demanding that the state and federal government take urgent action to clean up the Tijuana sewage crisis and to protect public health and ensure that we have access to clean water in our beaches and coastlines. But if the board approves this policy on Tuesday, it goes beyond just requesting more money. We're going to be increasing our commitment to protecting our beaches, bays, and coastlines by putting public health and clean water first and foremost. So now it's my pleasure to introduce Mayor Paloma Aguirre, who has been leading the effort to fix the Tijuana sewage crisis in the city of Imperial Beach and has been advocating and fighting for our community all over the country. Earlier this year, we were in Washington, D.C. together, speaking with lawmakers about this issue. And just last week, Mayor Aguirre was in Punta Bandera looking at the wastewater treatment plant to check on the progress with the rebuild that's being made down there. Today, she's here with us at the county. IB could not have a better champion for its health, safety, and future. Please welcome my friend, Mayor Paloma Aguirre.
Thank you so much, Vice Chair. We are so incredibly grateful for your leadership and support on this matter. It makes such a big difference. Good afternoon, everyone. I'm Paloma Aguirre, Mayor of the City of Imperial Beach. I want to again thank Vice Chair Lawson-Remer for bringing forward this board letter that is so critical in our fight for clean air, for clean water, and for basically having the human right to access to a clean environment. This issue is not just a matter of environmental concern, it is a profound public health crisis that has affected every asset of our life in our community. For far too long, the residents of Imperial Beach, Coronado, and South San Diego have suffered from the devastating impacts of sewage, industrial waste, and urban runoff contaminating our precious coastal waters and air. Over 135 billion gallons of untreated sewage have flowed into the Pacific Ocean, leading to over 900 consecutive days of beach closures. This has directly impacted our residents, small businesses, lifeguards, military personnel, and first responders. The health risks associated with this contamination are severe. Pathogens present in the sewage include bacteria, viruses, and parasites that can cause serious life-threatening infections. Recent studies from the Scripps Institute of Oceanography have shown that these pathogens can become aerosolized by ocean waves, exposing communities not just at the coast, but far beyond. This crisis requests urgent and comprehensive action, and I commend the County of San Diego, the City of San Diego, the City of Imperial Beach, and the Port of San Diego for declaring a local state of emergency and for the significant steps already taken. The recent federal appropriations of $310 million for the International Wastewater Treatment Plant and $144 million for the upgrades at Punta Bandera are crucial first steps. However, much more needs to be done. The County Board of Supervisors letter outlines essential strategies to expand our mobilization against this crisis. These include launching, as the Vice Chair mentioned, the Community Health Survey to assess broader health impacts, developing the Tijuana River Public Health Risk Dashboard, and creating local decontamination protocols for sewage-contaminated floodwaters. As the Vice Chair mentioned, there's been actually not just the one Hollister spill, but two. Just last week, there was a 300,000 gallon spill at Hollister Street. Without the decontamination protocols, this has the ability to cross-contaminate far and wide. I particularly appreciate the board letter's commitment to enhance communication and collaboration with various agencies to increase surveillance and testing. This will help us in early identification of potential contamination events and ensure timely public communication. As mayor, I pledge to continue working tirelessly with our local, state, and federal partners, with the County Board of Supervisors, with all the folks standing behind me. We will pursue additional funding and support to assess the economic and public health impacts of this crisis and secure the necessary infrastructure projects. I will continue to pursue, together with all of you, a California state of emergency and a federal declaration, because all of these efforts to better monitor and surveil public health, we are extremely grateful for them, but what we really need is to eliminate the source of all of this pollution. So that's what we're going to be focusing on. And I'll just close with one thing. The rehabilitation and expansion of the San Isidro plant and the rehabilitation of the Punta Bandera plant, which is another major source of pollution for us, is not what's going to give us clean air and clean water, because the primary source of pollution is the Tijuana River itself. And that does not have any funding allocated to it. There aren't any environmental reviews slated to assess how to divert and treat the Tijuana River. We are years away from that happening, which is why we need our state and our federal government to declare a state of emergency so that we can once and for all eliminate this toxic pollution contaminating our air and coastal waters. Our community deserves clean air and clean water, and we will not rest until this issue is permanently resolved. In the meantime, again, I want to reiterate my gratitude to Vice Chair Lawson-Remer and ask for the Board of Supervisors support on this very comprehensive board letter that is really going to help our community better understand what are the public health impacts so that we can continue to advocate for permanent solutions. Thank you very much.
With that, I'm happy to take any questions, and I'm sure our mayor would be welcome some questions as well.
One of the goals is to gather data according to zip codes. So how widespread do you think this is going? When the materials hit the surf, how far of an area, how wide of an area are we talking about?
I mean, I think that's the point of doing the research, right? Is to better assess. As I think everyone knows, I come from a very data-driven background, and to me, this is such an important initiative because if we're going to be able to fight for public health, we actually need to know what's going on in the community, and that's why we're gathering the data.
Mayor, can you talk about how this has affected you personally, how it's affected your community?
Thank you. That's why this survey is so important, because anecdotally, at the city of Imperial Beach, we're constantly hearing these stories from our residents, from our constituents, and beyond, from residents in Nestor and San Isidro, South Chula Vista. Upper respiratory ailments, headaches, nausea, pulmonary abscesses, meningitis, lower gastrointestinal illnesses. I personally have had a lingering cough for 5 weeks now. My husband was sick for almost 6 weeks. I don't even live close to the beach. I live 2 miles from the beach and 2 miles from the river. And I was sharing with someone earlier today that last night, obviously, it was very hot. I have a very small portable AC unit, and I turned it on and I got hit in the face like a wall of bricks with a stench. So that's what my community is facing. A lot of people who are able to afford an AC unit having to decide whether to turn it on or not, because opening your windows, it's not an option. And this is constant every day or every other day. So we deserve a better quality of life.
Yes.
Saying that the data, you're data driven and how important it is, because anecdotally you have all of this evidence, but you really don't have anything to report, right, to like a health department. How impactful do you think collecting all of this and working with the health department will it be to get, I guess, federal funding? Because it sounds like, it's going to take a lot to do something like divert river.
I mean, look, if we have data that shows that there's significant public health impacts, that I think opens up a lot of avenues. You look around at other places, when you see that the water is having public health impact, that's when you start being able to unlock pretty significant federal funding. So, I don't think we can know, but the real point of this is we should not be like an ostrich with our head in the sand, right? We know that people can smell the stench, and we know that the smell doesn't travel alone, right? It's traveling with bacteria. It's traveling with all the particles that are in the sewage. These travel together. So, and we also know all these anecdotes about folks getting sick, and there's initial studies from Scripps and researchers at UC San Diego and SDSU. And now it's really our job to say, okay, there's a little bit of info out there that says there might be a problem. It's our job to investigate and see if there is an issue, because we have to be in front of it.
Do you think the lack of data and ways of reporting it has contributed to why it's gotten so bad and really everyone would say overlooked in the area?
Well, I'm a researcher by training, right? I taught public policy for a number of years, and my PhD is in political economy, where you just look at data and you look at what works and doesn't work, and how you make a difference in government. And I think it's very apt to say that when things are not being counted, they usually don't count. And so that work that we have to do of gathering data to make the invisible visible is really crucial, so that we can tackle this problem head on. Right. Thank you all. Oh, one more question.
For those of us who live down there, it's been decades. Why the hesitation to actually do something about this? Why hasn't government stepped up, protected our health, our livelihood, our quality of life? Why do you think this is not been taken care of sooner?
I love that question. As I ran for office just about 3.5 years ago, I'd never been an elected official, and one of my top priorities is protecting our beaches and coastlines and fighting for clean air and clean water. And why did our old Board of Supervisors do nothing? Why did our old mayor do nothing? I don't know, but that's certainly why I'm here, because I think they weren't doing a very good job.